today. I have two monitors going on here so I can see you guys and do my presentation. So if you see me looking back and forth, that's what I'm doing. Thank you so much to Yasmin and Lana for organizing this and for having me. I think forums like this are super, super important, especially right now, given the pandemic and everything, you know, that's going on in the world. I really appreciate all of you being here, and I'm so excited to chat with you today. So as I said, I'm Dr. Ariana Witkin. I'm a board certified pediatrician and a postpartum coach. Today, we're going to talk a little bit about pediatrics, but we're actually going to spend most of our time discussing postpartum care and following your dreams. So we are going to dive in. Okay, so let's start with who am I and what do I do and why the hell am I qualified to even be talking to you guys today about this? So as I said, I'm a general pediatrician. I currently work as a newborn hospitalist in Cambridge, Massachusetts, which is where I live. And what that means is that I see babies as soon as they're born. So I see the babies, I see the moms and the parents that come with these babies. And I do procedures. So I do circumcisions, I do frenotomies, which is a procedure where you cut what's called a tongue tie, which is the little piece of tissue underneath the tongue. There's some thought that that can help with breastfeeding. I am also a postpartum coach, as I mentioned. So I educate, equip, and empower women for postpartum. I really think that the transition to becoming a mother is the biggest transition in a woman's life. And that's really what my passion is and what I do. So I founded my company about 9 months ago, and I've been working with women in this coaching capacity ever since, and I absolutely love it. I am also a mama to an amazing 2-year-old girl, Sadie. You can see that's a picture of her and my husband there. I'm a wife, I'm a daughter, I'm a sister, I'm a friend. I put all of these things here for you guys to see because being a doctor is part of my life, but it's certainly not my whole life. I think it's really important to kind of show all aspects of that. All right, so before we kind of get a little bit more into what I do, I want to address how to get to where I am. So how do you become a pediatrician? It's another picture of my daughter. This presentation is basically an excuse for me to show you adorable pictures of my daughter. So I hope you don't mind. So how do you become a pediatrician? So you do 4 years of undergraduate education, then 4 years of medical school. And then to become a pediatrician, you have to do 3 years of a pediatric residency. Once you graduate from residency, you'll be a general pediatrician. So you'll be equipped to work with newborns up through adolescents. And then if you would like to, you can do an optional 3-year subspecialty fellowship. So this would be if you want to do something like pediatric pulmonology, working with kids with their lungs, pediatric GI, working with the organs in the abdomen, etc. Okay, so how did I become a pediatrician? I did my undergraduate education at Brown University. I was not pre-med. My path was kind of a little more non-traditional. I majored in anthropology. I was really, really interested in cultures and societies worldwide, not so much in basic sciences. So I studied anthropology. I actually didn't know that I wanted to go to medical school when I was in college. I didn't really know what I wanted to do. Medicine was not really on my radar. So I actually worked for a nonprofit when I was in when I was in college, called Worldwide Orphans Foundation. And they're a nonprofit that has programs in a bunch of different countries worldwide, mostly third world countries. And they work with orphans and community children. So I worked for them throughout college. And my work with them took me to Ethiopia. It was first the summer after my sophomore year of college. And there I helped to build a summer program for orphans and community children with and without HIV. And it was really there that I decided that I wanted to go into medicine. My experience in Ethiopia showed me firsthand that all the things I cared about and was so, interested in and passionate about, like public health, education, women's empowerment, economic development, didn't really matter unless there was like a basic level of health. So for me, that's where I decided that I wanted to, do my focus. So that's when I decided to apply to medical school. because I really wanted to address all of these issues in a holistic way. So I actually applied to Mount Sinai School of Medicine. This program doesn't exist anymore, but once upon a time, there was a program called the Humanities in Medicine program, and it was for people just like me. So people who were not pre-med, who were more interested in the humanities. It was kind of like a off the beaten path way to get into medical school. So I applied. Thankfully, I was accepted. And then after college, I took a gap year. I wasn't ready to start medical school. I backpacked across Europe for a few months with one of my good friends. I moved in with, well, my then boyfriend, now my husband. And I worked at Boston Children's Hospital in pediatric cardiology. Since I wasn't someone who had, wanted to go into medicine from the moment I was born, I really wanted to make sure that medicine was the right choice for me. It's a big commitment, as I'm sure you are all well aware. So before I started on that path, I wanted to actually work in a hospital, get some experience, see if it was something that I really enjoyed before I started medical school. So I worked at Boston Children's, moved in with my boyfriend. Both things worked out, decided to go into medicine, decided to marry the boyfriend. And here we are today, I guess. So after I went to Mount Sinai, where I did 4 years, I applied to residency. That picture in the corner is of my graduation from medical school, and that picture in the middle is on match day. So I don't know how much you guys know about match day, but the way it works is after you do medical school, you decide what specialty you want to go into, and you apply for what's called the match. So you put a list of all the places that you can imagine doing residency into this computer program, and then the computer program picks for you, essentially, where you're going to go, what school you're going to go to. So I picked University of Washington, Seattle Children's as my first choice, and thankfully I matched there, so I moved to Seattle. So what happened after residency? So I graduated from residency in, 2018, and I've been working as a general pediatrician ever since then. My first job was as a NICU hospitalist. So I spent part of my time working at a tertiary care center, so one of the big medical centers here in Boston. I attended high-risk deliveries, mostly of preterm infants, but some term infants that had some medical problem that was noted prenatally, that was noted before they were born. I also worked in the NICU, and I taught medical students at Harvard. The past 2 years, I've worked as a newborn hospitalist at one of Harvard's community hospitals, again, here in Cambridge, working with well-term newborns, right? So as a newborn hospitalist, I work with mostly healthy babies, which is really so much fun. And then, as I said, about 9 months ago, launched my own coaching and consulting business, working with pregnant and postpartum women that I'm going to tell you about in a little bit. But before we kind of dive into that, I just wanted to read you this Rumi quote. When you do things from your soul, you feel a river moving in you, a joy. And I put this here because I just wanted to remind myself before getting too far into this presentation to tell you guys that if you get nothing else out of this presentation, you guys, if you take nothing else away, what I want you to know is this. No matter what you do, no matter what path you pursue in medicine or otherwise, just in life, the most important thing is to follow your dreams, right? Go where your heart takes you. Do things you're passionate about. Don't do something because you think it will make someone else happy. Don't be worried about disappointing people around you, and do not compare yourself to anybody else. In medicine and in life, right, there are often these kind of prescribed paths and tracks of how we think, what we're supposed to do, how we think we're supposed to do things, what we think we're supposed to do next. And the best advice I could give you is to forge your own path. So I really want you guys to take that away, if nothing else. Okay, in medicine in particular, or at least when I trained, there were kind of 3 generally defined and acceptable paths for someone to go into. You could be a clinician, you could be an educator, a teacher, or you could go into research, or some combination of these 3. I struggled a lot on a personal level during my kind of medical training journey because I never really felt like I fit into one of these boxes. And particularly, I think, because academically I was doing well, I was encouraged to keep going and really make myself fit into one of these boxes, even though I really didn't fit. I knew kind of throughout this whole process deep down that what I wanted was something else, right? All those bigger pieces that I mentioned before about advocacy, global impact still really mattered to me. And after learning kind of more about the traditional medical system, I really felt like those things were going to be best addressed outside of the medical system, and is one of the reasons why I decided to launch my own business. What I want you to know is that there are endless opportunities in medicine to carve out your own path, right? It takes being proactive. It takes seeking out mentors who are doing other things, maybe, you know, people that don't fall into one of these three buckets. Following your heart, pursuing things that you're interested in, and again, not comparing yourself to anybody else. So important. Okay, so what was my path? I alluded a little bit to this before, but wanted to give you guys a bit more of an insider look. So I will just say, at the time, you know, when I was kind of pursuing all of these interests, I had no idea where my path was taking me, right? I was just kind of following my passions, doing things that sounded interesting to me, but didn't really see like a linear connection. But now, looking back, and from where I am now, all my experiences were so clearly leading me to where I am now. So again, the most important thing is not knowing like from where you sit today to where you're going to be 10, 20 years from now. It's really following your interests, doing things that you're passionate about, even if you don't know how they connect, even if you're not sure, you know, how you're going to spin them in some interview, right? Like, that's not what I want you to think about. That will come if you follow your passions. I promise you that will come. So 3 things that I've kind of pursued have been global health, working internationally. It started when I was in college. I did a study abroad program, a public health program in Chile. I know, at least at the time, a lot of my pre-med colleagues were kind of discouraged from studying abroad because they couldn't kind of pursue internships and research if they were away for a semester. But again, for me, going against the grain, studying abroad was something that was really important to me. As I mentioned before, I also worked for the nonprofit in Ethiopia. I ended up going back the following summer after the initial year, again, kind of ignoring, you know, people that were chattering in my ear telling me, oh, maybe I should get some research experience if I wanted to go to medical school. No, right? That's not really what I was interested in. I continued kind of this path of global health work in medical school. I had the opportunity to do a medical ethics fellowship at Oxford. So I went to England the spring of my final year of medical school. And then in residency was part of a advocacy track that brought me to Kenya, working with a remote village about 5-6 hours outside of Nairobi. So another kind of thread that has been common for me throughout my career is camp. And if you're like, oh my God, summer camp, what does that have to do with medicine? I'm going to tell you. So from the time that I was young, I was, you know, super interested in working with kids. And again, looking back now as a pediatrician, I think, oh, that makes sense. But at the time, I had no idea where it was leading me. I actually started my own summer camp where I grew up in this town called Maplewood, a small town in New Jersey, for kids that I babysat for and neighborhood kids. And I ran that program for 3 years, you guys. And that was kind of my introduction, now that, you know, that I think about it, to entrepreneurship and to working with kids. As I mentioned, in Ethiopia, what I was working on was a summer camp program for orphans and community children with and without HIV. In Boston, I told you I worked for Boston Children's Hospital. That opportunity led to me being the co-director of a camp program for kids out of Boston Children's Hospital that have cardiac defects. And in New York City, in medical school, I was the co-director of a summer camp program for East Harlem Middle School students. So again, at the time, people were like, why are you working at summer camps if you want to go to medical school? But looking back, right, I have a clear thread of entrepreneurship, working with kids, designing programs, which kind of leads me to the last thread, which is this kind of curricular design piece. So as I mentioned, started kind of with summer camps and then evolved from there. So in residency, I was a consultant for an organization called Best Start Washington, designing a program for them on the importance of nature, kind of in pediatric education and pediatric care. I ended up getting a grant from the American Academy of Pediatrics to design and run a group program for immigrant mothers in Seattle, and then now today to launching my own business. So as you can see, looking back, right, these 3 threads kind of clearly connect to where I am now, even though at the time I had no idea where I was going. All right, so that brings me to what I am doing now. So I still work part-time clinically, as I said, as a newborn hospitalist. And then, as I said, about 9 months ago, started my own business as a postpartum coach. I am obsessed with demystifying postpartum, preparing women for the biggest transition of their lives, which is having a baby. So how did I get here? How did I go, again, from general pediatrician to entrepreneur? We kind of talked about my educational background and personal experience in my company really is a combination of the two, right? So as a pediatrician, I've worked with countless families, parents, newborns, older children, and I've really seen what the newborn and postpartum period looks like from that perspective. And then, as I said, a little over 2 years ago, I had my own baby, and oh my God, I was so not prepared for what I experienced. It was one of the hardest times of my life. And I'm a pediatrician, right? Like, I know all about newborn development. I know a ton about kids. I had resources. I had a support team. I have an amazing partner. I'm a resilient person, right? And still, the months after I had a baby were so overwhelming, so isolating, and so hard. After I had a baby, you guys, I literally wanted to call every single patient that I'd ever worked with and just be like, I'm so sorry. I clearly did not understand what you were going through. I really felt like that. And so after, kind of finding neutral again in my own life with my family, I really felt like that was the space that I wanted to contribute in. And I wanted to create something to really address that gap that exists in our medical system in postpartum education, postpartum support, and care. So taking my professional expertise and personal experience as a pediatrician, my personal experience as a mother, I created my business. Okay, so what do my days look like now? How does this actually work in practicality? How do I combine being a hospitalist, a mom, a business owner? So I work clinically part-time. My clinical job at the hospital technically is 60% time, or FTE as it's called. So practically what that looks like is 2 to 3 days a week. I tend to be in the hospital Tuesdays and Thursdays, every other Friday, and 1 weekend a month. In my previous job, when I was a NICU hospitalist, I worked 24-hour shifts, I worked nights, and that for me was just really not like a compatible schedule with life, with having a family, with having a baby, and really not what I wanted. So that's one of the major reasons that I changed from a NICU hospitalist to a newborn hospitalist. So now with my business, I tend to have 1 full day per week that's dedicated to my business, Wednesdays. As you'll notice, today is Wednesdays. So for example, today, at this point, I've had a client call right before this. I run a group program for pregnant women. That's happened. I'm doing this now. Later, I have a podcast interview. So I kind of try to batch a bunch of my business client-facing things on Wednesdays. And Mondays and Fridays, I try to leave for kind of behind-the-scenes business work and hanging out with my family as much as I can. Full disclosure, this equation is something that's like constantly evolving and changing. Right now, while I have a young child, it's important for me not to work 40 hours per week, right? I want to spend time with my family. But when I have older kids who are in school, who knows what's going to happen? We'll see. Okay, so that was part 1, kind of about me and my path in pediatrics. Hold on, let me just, okay. About me and my path in pediatrics. And now I kind of want to move more into part 2, which is really about postpartum care in the 4th trimester. So if you guys can see this graphic, it's one of my favorites. It really, talks about what the 4th trimester is. So for those of you that don't know, the 4th trimester refers to the 12 weeks right after delivery, right after having a baby. And the term 4th trimester actually was initially coined by a pediatrician, wouldn't you know? Dr. Harvey Karp, who some of you may have heard of. He wrote a book called The Happiest Baby on the Block. He does kind of a lot of things about infant soothing and promoting sleep for babies. So this term 4th trimester was initially meant to describe what it was like for babies right after they were born. So for mothers, for the birthing person, postpartum goes way, way beyond the first 12 weeks. I believe once you have a baby, you are postpartum for life. right? Postpartum, once you've had a baby, you can't go back. So, but for the purposes of this talk and for what I tell my clients, I really consider postpartum to be the full first year after having a baby. So, and that really has to do with the physical and emotional changes that go with being postpartum. The recovery is not linear, and you're certainly not fully recovered by 12 weeks. I love this cartoon. I think, it speaks to the fact that culturally we place a lot of emphasis on labor and delivery. There are a ton of resources on preparing for childbirth, and childbirth is really treated like the main events, when really it's kind of everything that comes after that that is the main event, right? We don't really prepare for what comes next. We prepare for this one day, then you're handed a baby, and we say goodbye. Right? Not okay, not acceptable. It's long overdue to start treating postpartum as the main event that it really is. And half the battle I find with women is really about setting expectations. Most people have this idea in their head of, what it looks like to be postpartum, and what that idea is and what reality is often are so, so different. Okay, so what are some of the physical changes women experience postpartum? So the first one I want to talk about is pain, right? Giving birth hurts. Sorry if you are pregnant or you haven't had a baby, right? I don't want to burst your bubble, but being in labor and having a baby is painful, right? And this might surprise some of you, but the pain is not over after the baby is out, right? So let's talk about vaginal deliveries, for example. Often women have tears after they've had a vaginal delivery, often requiring stitches that then scar, right? It's painful. It can be painful for, weeks after delivery. If you've delivered your baby through your abdomen, right? If you've had a C-section, that is major, major abdominal surgery. And the recovery for that is also on the order of weeks, right? Not days. So the pain, right? It's not limited to your vulva. It's not limited to where the baby came out, right? Or your abdomen if you've had a C-section. Your breasts are often very painful after having a baby, right? The process of milk kind of filling all the glandular tissue can be painful, lead to engorgement. We're going to talk more about that in a little bit. The next thing to mention are weight changes, right? So a lot of women are worried about getting back to their pre-baby body or pre-baby weight, right? Which is this like cultural obsession we have with being thin, which I could give a whole nother talk about that. Not the point of this talk. But I did just want to mention, according to the National Academy of Medicine, most women, like more than 50% of women, are still actually about 12 pounds above their pre-pregnancy weight at 6 months, right? So this idea that people have that they're gonna have their baby and then drop their baby weight is really false, right? The research does not support that. And this really impacts, right, your body image. It can impact relationships with your partner. And obviously there are health implications as well if you are, maintaining a heavy amount of weight for a long period of time. In terms of vulvovaginal concerns, so lochia, that refers to vaginal discharge after birth, right? So after you have a baby, there's still bleeding, there's vaginal discharge, and that can last up to 8 weeks, right? 8 weeks. Imagine having a period for 8 weeks. That's what it's like. You can also experience vaginal dryness. This has to do with low estrogen that occurs postpartum, the hormone, and that can definitely affect a woman's libido, women's sex life, right? Low libido in general is extremely common in the first year postpartum. So just so much going into this. Okay, I wanted to spend a minute talking about one of the things we had on that slide, diastasis rectus. So this is something that patients that you will find are very, very concerned about. So I wanted just to take a minute to chat with you about it. So diastasis rectus is when the rectus muscles, so the muscles in your abdomen you can see in the picture, is when that is separated by more than 2 centimeters. More than 2 centimeters is considered abnormal, and that's caused by anything that weakens the linea alba. So the linea alba is a tendon, like a tendinous raphe. You can see in the picture that kind of white line that's in the middle. It's formed by the connection of your abdominal muscles, and anything that weakens this is what causes diastasis rectus, right? Anything, and that can cause the abdominal contents to protrude forward, which, as you can imagine, would cause a little bit of a bulge and might make someone feel uncomfortable, self-conscious, which is why this is such a concern for our patients, right? So it is largely cosmetic. There's limited data that show it may be associated with some pelvic organ prolapse, but it is mostly cosmetic. Treatments that can help with this are physical therapy and weight loss as well. If it is associated with pelvic organ prolapse, pelvic physical therapy, which are physical therapists that are kind of done extra training on the pelvic floor and postpartum, and can be a really helpful modality as well. Okay, another physical change that I want to talk more about are breast changes and breastfeeding, because oh my God, breastfeeding is the hardest thing I have ever done. And when your milk comes in, it can be extremely uncomfortable. And I think a lot of people don't know that. So when your milk comes in, right? So a lot of people think when you have a baby, your milk is just there and you're able to breastfeed. Not true. When you have a baby, most women have what's called colostrum, which is the first milk. Colostrum is kind of yellow, sticky. We call it liquid gold because it literally has millions and millions of cells that are super important for your immune system, your baby's immune system, and your baby's developing brain. So important. But most women don't have very much, maybe enough for about a teaspoon each time your baby eats, if that. And then over, the next few days, the milk transitions from that immature colostrum to more mature milk. For most women, that happens sometime between about 3 to 5 days postpartum. So when people say milk coming in, that's what they're referring to. So sometime in that 3 to 5 day postpartum when your milk is really transitioning from that colostrum to more mature milk. So when that happens, it can be very uncomfortable. Breast can be hot, tender, full, engorged, right? And the way that you manage that is with ice packs and ibuprofen. Because that fullness, that firmness, right, which is really interstitial edema, it's edema like in the cells, right, in the walls of the cells, and that milk coming in is painful and tender. So you want to treat that, right? Again, typically, the woman's milk will come in 3 to 5 days after delivery. So often you start having some of these symptoms of engorgement, even as soon as 24 hours after having a baby. The kind of peak incidence is about 24 to 72 hours after having a baby, and then can continue again for about 3 to 5 days postpartum. The other thing that can be really painful with breastfeeding is nipple pain, nipple damage. Often women have bleeding, bruising, breastfeeding initially, the pain that is associated with it should feel kind of like chapped lips. If you imagine if you had chapped lips, that kind of feeling on your nipple. But if you have any of these other kind of more serious signs, bleeding, bruising, you want to get help immediately, right? Because that is not normal. So the American Academy of Pediatrics actually recommends exclusive breastfeeding for the first 6 months of a baby's life, which some women experience as a lot of pressure to breastfeed, disappointment if they're not able to, feeling like they have to suffer through pain if they're having it, right? So this recommendation is well intended, but we as a society have not provided the support to carry the weight of that recommendation and to make it a reality without it feeling like a ton of pressure and guilt on women who decide that they don't want to or can't, for whatever reason, breastfeed. So breastfeeding education is not a routine part of medical school and residency education. So what I would say to you guys is that if you are going to be working with women in any capacity, right? Not if you're going to be a pediatrician or an OBGYN, if you're going to be working with women in any capacity, breastfeeding education is so important. And you have to seek out opportunities for that because they're not a routine part of your journey. Postpartum women right now have one follow-up visit with their OB at about 6 weeks. So it's often us, the pediatricians, who are seeing these women because we're seeing these babies often every few days in the first couple weeks postpartum. And so we're getting asked about breastfeeding and we're failing them, frankly, in a big way because we're not teaching the next generation of pediatricians how to deal with all of those concerns. Okay, so let's talk about the social and emotional changes that occur after having a baby because this is huge. So emotional symptoms vary greatly, right? From high highs to low lows. It is normal to feel sad. It is normal to feel exhausted. It's normal to feel overwhelmed. It's normal to cry for no reason, right? When you're happy, when you're sad. In these first 2 weeks, there's actually something called the baby blues. So the baby blues affects up to 80% of women, 80%, okay? That's a lot, 80% of women postpartum. And it describes these feelings, like I said, of sadness, of exhaustion, of irritability. The hallmark, you guys, of baby blues is the time frame. So it cannot last more than the first 2 weeks postpartum. If it does, it is no longer the baby blues. It is a PMAD. So PMAD stands for postpartum mood and anxiety disorders, and these affect up to 20% of women. In reality, it's probably more than that. The way that number, that 20% number, is from self-reported data, and we know that people in general underreport mental health disease. So it's probably even greater than that, you guys. It's probably more like at least 25%, which again is a lot, right? If you think about how many women are having babies every single day. And the hallmark of PMADs, right, is that the symptoms make it hard for you to care for yourself, make it hard for you to care for your baby, or to do everyday things like eat, or take a shower, or even leave the house. And so the time frame here is anytime after those first 2 weeks, right? So once we get past the time frame of the baby blues, through the whole first year postpartum. Remember how I said postpartum doesn't end at 6 weeks or 12 weeks? Yeah, right? This is part of our evidence for that. You can get diagnosed with a postpartum mood disorder anytime in the first year postpartum. So important. And that's why it's important for anyone working with women, not just in pediatrics or in OB, to keep this in mind, right? Because you will see women in the first year postpartum, no matter what fields you go into. The other thing I want to make sure you guys know is that PMAD, so postpartum mood and anxiety disorders, are not just referring to postpartum depression or postpartum anxiety, which are probably the two that are most commonly talked about. There's also postpartum OCD, there's postpartum PTSD, there's postpartum psychosis, right? So this is a range of mood disorders. Basically, if you are working with a woman who is postpartum in that first year and is sad or anxious, is having trouble sleeping, if she feels guilty, if she feels rageful, if she has racing thoughts, right? If she's scared to be alone, right? There's so many symptoms. But anyone that's giving you clues, right, you want to get them help immediately. Obviously, if someone is having thoughts of hurting themselves or their baby, that's a 911 call or a trip to the emergency room. But some of these more subtle signs you want to be able to recognize so you can refer them appropriately. In addition to these kind of formal diagnoses, right, in addition to PMADs, having a baby is a huge transition, right? Like massive. I don't even think there are words, right, to describe the enormity of this transition. Women often feel isolated, they feel alone, they feel like nobody understands what they're going through, and their whole life has changed, right? You can no longer just kind of like pick up and do whatever you want. Another person is totally, literally, and completely dependent on you, right? It's a time when a lot of women face identity shifts about what they want to do in the world, how they see themselves, where they want to go in their career. And they really have, big questions about their life. It also puts a strain on relationships, right? Not only your relationship with your partner, but with your family, with your friends. There's just a lot of things that are in flux around this time. Still, to this day, right, there is a lot of stigma about these issues, and they're just not talked about enough. People are worried about being judged. They're worried about what it means if they say out loud that they don't, absolutely love everything about being a new mom. And they feel like people are going to judge them, right? The point is that perinatal depression, mood disorders, PMADs, are a big, big deal. Maternal suicide, so deaths from maternal suicide, actually account for more deaths than postpartum hemorrhage and hypertension as maternal mortality, right? So that's huge. This is telling us that the mental health changes that occur postpartum are affecting the health of our patients greater than the physical changes, and it's long overdue for us to pay attention. Okay, so a big part of the mood symptoms and mood disorders are related to just like the sheer exhaustion that comes with having a newborn. This is me with my baby when she was, I don't even know, I think like a couple weeks old. She would not sleep in any place other than on a warm body, which was exhausting, right? So I like to give a few tips to my clients and patients that I work with, and I wanted to share some of them with you in case you guys come across postpartum families as well. So the first thing that I would recommend is trying to divide the night into 2 5-hour shifts, because if you're early postpartum, your baby is going to be waking up super frequently. It is exhausting. You want to divide the night. If you take like a 10-hour night, say from 9 p.m. to 7 a.m., you guys probably all sleep way later than 7 a.m. Sorry, I'm old and have a baby, so I wake up like by 7 a.m. So if you think of the night like from 9 to 7, right, you want to divide that into 2 5-hour shifts. And your job as the birthing parent or the mother is to sleep during one of those shifts while a support person or partner takes care of the baby during the other shift. If you're breastfeeding, this can be hard because newborns need to breastfeed more often than every 5 hours. Often they want to eat every hour or two. The support person should bring the mother, the baby in bed so she doesn't have to get out of bed. She breastfeeds, and then the support person does everything else, changing the diaper, burping the baby, soothing the baby, and getting back to sleep. So, so important. Other things that can help with sleep, are basic sleep hygiene. So keeping things dark at night, blackout shades in the bedroom are huge. Having a white noise machine helps both mom and baby sleep. As much as possible, setting up like a regular wake up time. So waking up within the same 30-minute window every day can be really supportive of your body recognizing sleep-wake cycles. And then getting natural sunlight early in the day as much as possible. That helps to regulate the circadian rhythm. The next thing is to try to stick to a loose routine during the day, right? I do not like to use the word schedule for postpartum women at all, because there's no such thing as a schedule within newborn, but having, some sort of routine that includes limiting caffeine to maybe, 1 or 2 beverages a day, exercising, even if that's just like a walk around the block, that totally counts. And taking strategic naps, so you're getting, 1 to 2 naps in at least a day, can be really supportive of good nighttime sleep. If you have a newborn, and then creating some sort of bedtime ritual, even if it's like 2 minutes, having some sort of consistent cue for your body that says it's time to rest. So avoiding screens if you can for an hour before bed, because that helps your brain kind of shut down. And then doing something like reading a few pages of a book or listening to, a podcast in your headphones, something that cues your body for bed. And then the last tip I like to give my clients, especially if they're breastfeeding, is to have a light snack before bed. When you are breastfeeding, at least for me and for most of the women I work with, you are often starving most of the time, and you do not want to wake up hungry. So having, a light snack, a banana, a cheese stick, right? I'm talking about like a giant steak right before bed can be supportive of you sleeping as much as you can. When all else fails, I tell people, remember, this is temporary. This is time limited. When you are in it, it's so, so hard to see, but I promise this too shall pass. So, to kind of summarize, right, change is needed on a systemic level. The current medical model, as I said, supports a single postpartum visit, one visit, you guys, for all of these things and so much more that we just talked about at 6 weeks. And I hope you can see that that is grossly inadequate, okay? The physical, emotional, the social aspects of postpartum really demand that a woman be followed more frequently, at least for the first year. We need to change the cultural narrative, right? So how do we do that? What are the steps? It starts with sharing, right? With speaking your truth, with sharing your experience. If you are a parent or the partner, of a new mother, right? Talk about your experience. If you have friends or you have family who are having a baby, really be with them in that space of the unknown, right? Talk about how hard this time is. Start to make a change. Make a postpartum plan. That's one thing that I do with my clients. I'm happy to share more information with anyone about that who's interested. But it's ultimately the creation of kind of this postpartum care framework that is so desperately needed to be incorporated into the medical system. And that is something that I am actively working on. So in closing, I just want to remind you, I told you if you get nothing else out of this, right, that it is okay to get off the train of kind of standard medicine. Like postpartum, non-traditional paths in medicine are often not talked about. And this doesn't mean that they don't exist, right? Follow your passion, do what you love. That is going to serve you well. So that is what I have for you guys. I'd be happy to answer any questions. I left my contact info on here. Feel free to email me. I also left my Instagram handle on there. That's how I share most of my educational content with patients and clients. So feel free to follow me, send me a DM. I'm happy to chat about anything.
Thank you so much, Dr. Witkin. This was awesome. I think if you open up the chat, you can see like all the praise coming your way, and everyone's super thankful to you for educating about this, because it's really like unsaid topics that not a lot of people speak openly about. There's a lot of people saying they're going to go thank their moms now after they know what they've been through. So thank you for that. I guess we can get through just several questions. We have about like 10-15 more minutes left. There's a really interesting question. Someone said, do you think that PMAD like has become something that you will see or have seen in more numbers because of COVID and like the isolation that people are feeling?
Yeah, that's a great question. And we actually do have data on that, yes, we are seeing now higher numbers of PMADs since COVID has started. So I think they started doing that research in the fall. So maybe about 6 months after COVID started. And yes, absolutely, like the isolation and the quarantine and restrictions have absolutely contributed to the increase in postpartum mental health disorders.
Great. Thank you so much for answering that. I guess kind of going off of that, a lot of people were wondering how COVID has impacted your practice in general. Have you been doing more like telehealth, telemedicine visits? Is it safe for new mothers to come see you in person?
Yeah, that's a great question. So in terms of the clinical work that I do, I'm a hospitalist. So I see babies right after they've been born at the hospital. So that work, unfortunately, cannot be done virtually. When a baby is born, one of the things we do is a head to toe exam to make sure there's no congenital abnormalities. And so there's no way to do that other than to do it, right? To see them physically. Other things that we're kind of looking at are their weight. So checking their weight is super important. So even kind of after they leave the hospital, we strongly recommend that they see their primary care pediatrician in person, really for that whole first year. If there are certain issues that are, specific to feeding, that might be able to be dealt with over the phone, but really to make sure that they're gaining weight, to stick to the vaccine schedule, to assess the mother, right, for these kind of postpartum issues. It's so important that we're seeing these people in person. In terms of my postpartum business, that work is actually all virtual. I launched my business 9 months ago, so during the pandemic, and part of it really was to help even fill the gap that the pandemic was leaving of all of this telemedicine. So those clients I work with all virtually. I have clients all over the world because a lot of what we do is kind of this education and empowerment, not so much like the physical medicine that has to be done in person.
Great, thank you so much. We had a really interesting question asking if you work with mothers that have PCOS, and if so, do you work with them with breastfeeding? Because sometimes they have a little bit of an harder time with breastfeeding and producing milk.
Yeah, great question. So yes, I do work with women with PCOS, work with women with other health issues, diabetes, high blood pressure, preeclampsia, which is, high blood pressure that comes up during pregnancy. I work with women of multiples, so have twins, women who are advanced maternal age, which is considered over 35, which is, I know it's silly that that's advanced maternal age, but it is. And I work with them on breastfeeding as well. What I do is, again, to provide kind of like the general information and education about breastfeeding, because I think a lot of that is kind of unknown. And actually a lot of the norms that we think of breastfeeding are really specific to bottle-fed babies. Even a lot of the images that we see culturally of women breastfeeding kind of in a horizontal position, that position is really meant for bottle-fed babies. Breastfed babies physiologically and developmentally really should be vertically. So anyway, I do a lot of that education virtually. If I ever feel like somebody needs to be seen for a breastfeeding issue in person, I have a network of in-person lactation consultants that I definitely use and refer to.
Great, thank you so much for answering that and giving some more information on it. We had a good question about if you've seen any trends showing that any signs of COVID could be transferred in newborns, if that's something that we should be concerned about, if there's any studies to look through about it.
Yeah, so kind of the biggest study of COVID in newborns was done towards the beginning of the pandemic in China. It had about 2,000, I think maybe 2,500 kids. And it was looking at the number one, could kids get affected with COVID and what was the severity? And what that showed was that in general, kids are less affected than adults by COVID, so less likely to get COVID. But of the kids that do get affected, it's newborns that are most severely affected. At my hospital, we test all babies whose mothers are positive for COVID, of which I've had many throughout the pandemic. And I recently had my first positive COVID test in a newborn. Yeah, which is super sad. We do not think, so there's studies kind of ongoing now of the placenta and of breast milk, and this data is still ongoing, but the current thought is that COVID is not spread, that it does not cross the placenta, so that an infected mom does not infect her fetus, or and that it is not spread in breast milk. So we think that those cases of COVIDs getting newborn are really transmission after they're born, not from being transmitted in utero. Does that answer your question?
Yes, thank you for that. And I guess kind of going off of that, there's a lot of COVID questions. I think a lot of people are kind of the theme of the year. So people are wondering if the same can be said for like the vaccine for antibodies. Like, do you recommend that pregnant women get the vaccine? And have you seen any research that like babies will have the antibodies, or if that's like even known at this point?
Yeah, so that's also a great question, and that research is also ongoing. So the short answer is no, we don't have any definitive evidence. But looking at, the mechanism of the vaccine and other vaccines that we give pregnant women, right? Because pregnant women have received other vaccines for years and years and years. We do think that it is likely that if a pregnant woman gets the vaccine, that her fetus could potentially have those antibodies. And same for breastfeeding. There's actually super exciting data that just came out with breastfeeding that the COVID virus is not, as I said, transmitted in breast milk, but antibodies are. So that breastfeeding your infant, if you have had either COVID infection or have gotten the vaccine, is potentially protective of that breastfeeding infant. So yes, to kind of answer your question, no, there's not definitive data. And yes, I recommend that pregnant women get the vaccine.
Awesome. Thank you for sharing that. A lot of people have been wondering, and we've just been hearing conflicting information. So thank you for sharing your expertise on that. Kind of shifting away from the COVID questions, there were a lot of questions asking about how you started your postpartum coaching business. If you have like any background in business, if you feel like it would have helped you, do you think medical school should require business schools, and just kind of your thoughts on that?
Yeah. Oh my gosh. Great question. So the short answer is no, I do not have any like formal business training. I don't have an MBA. I didn't go to business school. For me, again, it was really just kind of this like long line of experiences that led me to this point, and feeling like to have the change and impact that I really feel like is necessary, that for me, that was going to have to happen outside of the traditional medical system. And so for me, that meant starting a business. It has certainly been messy and not linear, and me just kind of figuring things out as I go. I do think that one of the great things about medicine, or that having an MD, is that it tends to open doors, right? It opens doors not just in medicine, but in other areas, right? So when when people contact me, or I contact press outlets, right, to lead with, I'm a board certified pediatrician, right? I got my MD from this, whatever, that kind of opens doors, and people are curious about what I'm doing, even if I don't have formal business training. Does that answer your question?
Yes, that's perfect. Thank you so much. We had a really interesting question that a lot of people wanted answered. Did you ever feel like you lost any time going through and getting fellowships, grants, and jobs as you continue through your career? Because, we all feel the pressure of just doing everything under the sun and not having enough time. So a lot of people would love to know, if you feel like any of that was lost time.
Yeah. So, I don't really feel like any of that was lost time. I think, to be totally transparent with you guys, I think that medical schools know, right, when people are just kind of doing things to like check all of the boxes, right? So like if we see, in residency, I helped to sort through applications and was on the committee of deciding who we were going to interview, right? And it's obvious to someone reading your application if you're just trying to like check a box in research, check a box in volunteerism, check a box in, whatever it is. It's much more compelling to see someone that has had kind of this track record of being interested in similar things and pursuing their passions, right? And then when you also think about in an interview, so much easier to talk about things that you're passionate about, like genuinely, other than trying to, make an experience that you did because someone told you should do research to get into fellowship, and then you have to try to talk about that even though it's not really something that's important to you. Does that make sense?
Yeah, thank you so much. That was a great answer. We have a lot of people asking just if you know anything about DOs in pediatrics, or if you think that having the background in osteopathic medicine would be helpful in postpartum coaching, knowing that they go through a little bit of a different route of medicine.
Yeah, that's a great question. So, personally, I am not a DO, so I'm definitely not an expert in the education of DOs. But I definitely have worked with DOs, both who are pediatricians and obstetricians in the hospital and throughout. And I think definitely that is a great path to go on for someone who is interested kind of a little bit more, in their craniosacral methods or kind of in their line of training. Yeah, and I could definitely see that potentially being helpful with postpartum.
Great, thank you for your answer to that. We appreciate that. So throughout the presentation, a lot of people asked about, I guess, just minority, Black, Latino patients, and just in general, like in pediatrics and postpartum coaching, where do you see the disparities, and where do you kind of see like where the future generation should work in fixing disparities between minority patients?
Yeah, so thank you for all of you who asked this question. There, as you probably know, because you asked this question, there is a huge disparity, not only in postpartum care, but in pregnancy care, right? And in maternal morbidity and mortality, right? So African-American women, brown and Black women are much more likely to die in childbirth, are much more likely to die of postpartum complications than their white female counterparts. So I think in terms of where the gap is, that's where it is, right? We know that these patients are dying more than the white patients, which is not acceptable. And I think that it's multifaceted. This could be like a whole nother hour presentation. But one of the reasons I think is distrust in the medical system, which again stems from actions that we, white physicians and white people in power have taken historically against this community. So that's kind of number one. Number two, I think, is, a lack in access, right? And that has to go to, where different populations of people live, what kind of access to care do they have, right? What is available in one community is going to be different than what's available in another community. So making systems of care more equitable. And then in general, it's about education, right? I think women's of all colors, of all shapes and sizes don't know like what to look for, right? Like what are red flags postpartum? I didn't know before I had a baby, even after I had a baby, right? It wasn't really until I started doing a lot of this postpartum work that I learned some of that. So that is not a complete answer. But I think, to start to unpack some of these like historical wrongdoings, right, that we have done to some of these Black and brown communities that now show up in these disparities in postpartum care is going to take, a lot of work and more than just kind of one like stopgap in postpartum education, right? It requires change on a systemic level from medical education all the way up to, kind of treating patients once they're in different health situations.
Thank you so much for that answer. I mean, like you said, it could definitely be a whole other hour talk. So thank you for giving us a little snippet of that. And someone said that they love your take on this. So thank you for sharing that with us. I guess we'll ask one more question before we do a little wrap up. There were a ton of people throughout the presentation asking if you personally work with like PAs or NPs and what their capacity in pediatrics or postpartum coaching would look like.
Yeah, so I work, where I work, I don't so much work with PAs, just in this part. I think for some reason it tends to be like regional. Some hospitals work more with NPs and some hospitals work more with PAs. So the hospital that I'm in works more with NPs. But yeah, so I've worked with a ton of NPs, pediatric NPs, OB NPs, and I think they are hugely important to the healthcare system, especially as we try to do some of these more educational pieces and support pieces that again are just so foundational to medicine. I was going to say postpartum care, but really to medicine in general, right? So I definitely think that there's a place for that. Again, I can't really speak so much to like the education and training because I'm not super familiar with that.
Great, thank you so much for answering that. We always get so many questions about it. But we're gonna end with this last question. It's our personal one. As we are hopefully in the near end of this pandemic, and all that, do you have any last piece of advice for us as college students, as pre-meds, navigating through this really weird time?
Yeah, such a weird time. Yeah, so I mean, I think doing things like this, right? Like expanding your, I mean, you too, right, are an example, expanding your vision of what it means to like follow a traditional career path or a traditional path to get into medicine, right? Like kind of abandoning that and doing things that are innovative, different, and that are interesting to you. Because again, there's no kind of one right way to be on this path. And it's really following your passions and doing things that you find fulfilling that's going to get to where you want to go. Even if you don't know how that connects right now, promise you, looking back, you're going to be like, well, yeah, I did this and this and this. And it's going to be like a clear line to wherever you end up.
Thank you so much. Someone said it perfectly. You made us really excited about medicine, and you have such a warm and comforting personality. You make it feel super safe. So thank you so much. This was all just like amazing advice, and there's not too many parents in this talk, but I think you opened our eyes to a lot of what other people go through, like what to expect, and not in a really like harsh way. We're not super scared. So thank you so much for all that.
Yeah, thank you guys so much for having me. This was so much fun.
Of course. If you open the chat, you can kind of see like all the nice things that are being said.
Oh, so nice.
But we hope you have a great rest of your day, and we will keep in touch and hopefully talk soon.
Take care.